The relationship between a doctor and a patient is a sacred one. There is an established trust and an intimacy when you put your life in someone else's hands. But in the times of COVID-19, when social distancing and isolation are crucial to survival, doctors and their patients are having to redefine the rules of their bond. Our next story explores more.
The visuals on your screens give you a glimpse of the special bond between a doctor and a patient. For a doctor, it indeed is a victory when his patient walks free of the deadly COVID-19. But the happiness of these healthcare workers is masked behind different layers of protective equipment, which is not a luxury anymore. It is their only shield from this deadly infection. As COVID-19 continues to claim lives across the world, healthcare workers are on the front line, and they are the most vulnerable as they spend their days and nights tending to COVID-19 patients. As the virus changes the way we communicate and connect with friends and family, another relationship is becoming a casualty of this contagion. The bond between a doctor and a patient is now changing. One virus is setting new rules of treatment and engagement between a doctor and a patient. After all, it becomes impossible for a patient to find solace in a masked doctor in a hazmat suit. Before COVID-19 invaded our lives, patient care involved counseling from a smiling doctor who assured you that the worst was over. A pat on the hand, a reassuring handshake, and at times a knowing smile from your doctor did wonders in calming nerves. And now COVID-19 has redefined patient care and thrown new communication challenges at all of us. A patient suffering from COVID-19 is kept in an isolation ward for treatment. He or she cannot see their friends or family, and the sole communication is with the medical workers. A handshake or any form of touch without protective gear is a strict no-no. Doctors and healthcare workers are masked and suited up in head-to-toe protective gear. A muffled, masked voice gives the diagnosis and the future course of treatment. Even if there is a kind, reassuring smile, it is concealed behind this mask. Doctors on their part are trying their best to provide relief to patients. In one such hospital in California and the US, doctors realized how isolated their patients felt both in mind and body. So they made giant laminated badges with their smiling faces so that their patients could see who in fact was treating them. A beaming smile pasted on a hazmat suit, doctors say it did wonders to boost the morale of a patient. COVID-19 has infected more than 2 million people and claimed more than 134,000 lives across the globe. And healthcare workers are missing connecting with their patients.
You do not have the intimacy that we had with our patients before the coronavirus era. The patients do not see a face, they see a doctor in protective gear, and often they don't recognize them.
It's a bit weird and totally unusual for us. We had been used to entering the wards, seeing the patients, shaking their hands, saying good morning, laughing with them, getting to know them, and for our patients to get to know us and to see us.
But some patients have already adapted to the new rules of the doctor-patient relationship.
The doctors are always behind a mask. But of course, I recognize them. They visit regularly and very often they show an interest in you and they give courage to the patients.
Bureau Report, WION World is One.